With COVID-19 vaccines being administered in some countries, the permanent representative of the Holy See to the United Nations in Geneva says the Holy See is concerned about access to the vaccine around the world.
So some countries are having more rights again than the other countries. And the Holy See must be attentive. We are doing all the best what we can that will protect the equal as possible, as possible, the distribution of the vaccine.
At a time where we receive bad news about COVID-19 infections on a daily basis, there's light on the horizon as vaccines to protect people from the virus are available as early as this month. The Nuncio to the United Nations in Geneva is joining me now. Good afternoon, Your Excellency.
Good afternoon, Christian.
You participated in a meeting earlier this month about patents and health of the Standing Committee of the World Intellectual Property Organization in Geneva. In your statement, you expressed certain concerns.
We have today a problem. If you don't protect patents, you have no development. If you protect patents, you have development only in the rich part of the world because the poor countries have no means to protect and promote the patents. The Holy See sees necessity in coordinating, in keeping attention of two aspects. Let's say, protect patents, which is important, but also to think that the other who are outside would have access to the benefits of patents, because patents have enormous impact on the economic life and also on the social life. The life changes when a technology changes. And this is our duty and what we are doing with the Standing Committee.
Vaccinations and injection techniques are not new to mankind. Evidence exists that the Chinese employed smallpox inoculation as early as 1000 AD. Modern history of vaccination is closely linked to the English surgeon Edward Jenner. In 1796, he carried out a smallpox immunization of an 8-year-old boy. The boy remained healthy. This was the prototype of vaccination. For those who feared the needleless inoculations already were administered in England in 1967.
In this Christmas period, almost all governments and all the world makes statistics and balances of this year. The fact that we discovered in this period is that we are really in need of universal coordination of the efforts that we have.
In your statement, you said, and I quote, "The Holy See would like to emphasize that intellectual property should be subordinated to the requirements of the common good."
To protect common good is more necessary today than ever. Who can do that? Single states, difficult. United Nations, criticized, but they have to do that, and we have to support them. One of the aspects of this solidarity in the world, which we feel today, is that we are all afraid that COVID crisis will bring to new distinction, also the differentiation of rich and poor.
Currently, we are witnessing that Western countries buy almost all first-round vaccines produced, and poor countries are not benefiting immediately. It seems that the UN, the World Health Organization, and the World Intellectual Property Organization already failed right from the start.
We are talking about coronavirus racism or nationalism. So some countries are having more rights again than the other countries. And the Holy See must be attentive. We are doing all the best what we can that will protect the equal as possible, as possible, the distribution of the vaccine.
In Florida, Miss Maxwell, an emergency department registered nurse, was the first Mayo Clinic employee to receive the COVID-19 vaccine on December 17th. Maxwell was among a team vaccinated at the Jacksonville, Florida campus. We are all in the same boat, where one person's problems are the problems of all, writes Pope Francis in his recent encyclical letter Fratelli Tutti. Once more we realized, the Pope wrote, that no one is saved alone. We can only be saved together.